A cryptic pregnancy, also known as a stealth pregnancy, is a pregnancy that goes undetected until the later stages, sometimes even until labor begins. This phenomenon can be incredibly bewildering for the women who experience it, as they may not exhibit the typical signs of pregnancy that most expectant mothers do. This means a woman might be pregnant for weeks or even months without knowing it. The absence of noticeable symptoms like morning sickness, weight gain, or a growing belly can make it difficult to recognize the pregnancy. Imagine the surprise and often the shock that comes with such a discovery. For many, the realization only comes when they are already in labor or very close to it, which can be a highly stressful and emotional experience. Cryptic pregnancies are rare, but they do happen. They challenge our understanding of pregnancy and can be emotionally overwhelming for the women experiencing them. The lack of awareness can lead to a range of emotions, from confusion to anxiety. They challenge our understanding of pregnancy and can be emotionally overwhelming for the women experiencing them. The sudden realization of being pregnant can bring about a whirlwind of emotions, including fear, excitement, and uncertainty. It's important to remember that every woman's body is different and reacts to pregnancy in its own unique way. Some women may not experience the classic symptoms, and their bodies may not show the usual signs, making it harder to detect the pregnancy. While the exact reasons behind cryptic pregnancies are not entirely understood, several factors can contribute to their occurrence. Hormonal imbalances, irregular menstrual cycles, and certain medical conditions can mask the typical signs of pregnancy, leading to a delayed diagnosis. And certain medical conditions can mask the typical signs of pregnancy, leading to a delayed diagnosis. Additionally, psychological factors and stress can also play a role in how a woman's body responds to pregnancy. In the following sections, we'll delve deeper into the complexities of cryptic pregnancies, exploring the potential causes, symptoms, risks, and diagnostic methods. We'll also discuss the importance of timely medical intervention and support systems for women who find themselves in this unique situation. Understanding this phenomenon is crucial for providing appropriate care and support to women who experience it. By raising awareness and educating both the public and healthcare professionals, we can ensure that women receive the help they need during such unexpected and challenging times. Cryptic pregnancies are a bit of a mystery. They are a phenomenon that challenges our understanding of how the female body works and how it communicates its state to us. They challenge our understanding of how the female body works. The complexity of the female reproductive system means that not all pregnancies present in the same way. Why do some women experience typical pregnancy symptoms while others remain oblivious for months? This question has puzzled both women and healthcare providers alike. The answer lies in a complex interplay of hormonal fluctuations, individual physiology, and external factors. Each woman's body is unique, and so is her hormonal balance. One contributing factor is irregular menstrual cycles. Women with irregular periods may not notice a missed period, a common early sign of pregnancy. This can lead to a delayed realization of their condition. Women with irregular periods may not notice a missed period, a common early sign of pregnancy. This irregularity can be due to conditions like polycystic ovary syndrome or thyroid disorders. These conditions can disrupt the regularity of menstrual cycles, making it harder to detect pregnancy. Hormonal imbalances can also play a role. Hormones are the body's chemical messengers, and any imbalance can lead to a variety of symptoms, including those that mask pregnancy. Low levels of human chorionic gonadotropin, the hormone detected in pregnancy tests, can lead to false negative results. This can be particularly confusing and misleading for women who rely on these tests for confirmation. In some cases, the body may produce HCG at a slower rate than usual, making it difficult to detect in early pregnancy. This slow production can delay the confirmation of pregnancy, adding to the confusion. Furthermore, certain medical conditions, such as uterine fibroids, can mask pregnancy symptoms. These fibroids can cause symptoms that are easily mistaken for other conditions. Fibroids are non-cancerous growths in the uterus that can cause irregular bleeding, bloating, and abdominal discomfort, mimicking common pregnancy discomforts. This can make it difficult to distinguish between the two conditions. Psychological factors, such as denial or a strong desire not to be pregnant, can also contribute to a lack of awareness. The mind can be a powerful influence on how we perceive our physical state. In such cases, the brain may subconsciously suppress the physical signs of pregnancy. This psychological denial can be a significant barrier to recognizing the condition. Understanding the potential causes of cryptic pregnancies helps to demystify this phenomenon. By shedding light on these factors, we can better support women who may be experiencing this condition. By recognizing the factors that contribute to delayed diagnosis, we can raise awareness and encourage early detection through regular medical checkups and open communication between women and their healthcare providers. This proactive approach can lead to better health outcomes for both the mother and the baby. While cryptic pregnancies are characterized by the absence of typical pregnancy symptoms, some subtle signs may still be present. These signs can often be so mild that they are easily overlooked or mistaken for other common health issues. Recognizing these signs is crucial for early detection and intervention. Early detection can help ensure that both the mother and the baby receive the necessary care and support throughout the pregnancy. One common sign is irregular bleeding or spotting. This can be particularly confusing for women who already experience irregular menstrual cycles, as it may be mistaken for a light period or breakthrough bleeding. This bleeding may be mistaken for a light period, especially in women with irregular cycles. It's important to track any changes in your menstrual cycle and note any unusual patterns or symptoms. However, it's essential to remember that any bleeding during pregnancy should be reported to a healthcare professional. Even if the bleeding seems minor, it could be an indication of an underlying issue that needs to be addressed. Changes in breast size and tenderness can also occur in cryptic pregnancies. These changes might be subtle and not as noticeable as in typical pregnancies, but they can still be a sign that your body is undergoing significant changes. However, these changes may be less pronounced than in typical pregnancies and can easily be attributed to other factors such as hormonal fluctuations or weight changes. It's important to pay attention to your body and any changes that occur, even if they seem minor. Some women may experience fatigue and nausea, but these symptoms may be mild or attributed to stress, dietary changes, or other common ailments. Fatigue and nausea are common symptoms of many conditions, so they can be easily overlooked as signs of pregnancy. Similarly, food cravings and aversions can occur, but they may not be as intense or specific as in typical pregnancies. These changes in appetite can be subtle and may not immediately suggest pregnancy to the individual experiencing them. It's important to note that these signs are not exclusive to pregnancy and can be caused by various other factors. Hormonal imbalances, stress, and other health conditions can all produce similar symptoms, making it challenging to identify a cryptic pregnancy without professional medical advice. However, if you experience any of these symptoms, particularly if you have irregular periods or other risk factors for cryptic pregnancy, it's always best to consult with a healthcare professional to rule out pregnancy. A healthcare professional can provide the necessary tests and evaluations to determine if you're pregnant and offer guidance on the next steps. By paying attention to our bodies and seeking medical advice when in doubt, we can increase the chances of early detection, ensuring proper prenatal care and support for both mother and baby. Early detection is key to a healthy pregnancy and can help prevent complications down the line.
You want to just go like that? Guys, please help me like, share, and subscribe. Thank you for watching the video to this point. Please hit the red subscribe button so anytime I drop anything, you'll be notified about it. Thank you. See you in my next video.